So good morning, conference. It is really, really good to be here, and I'm particularly pleased that I'm included in the lineup with all the young people in the DUP. I think that's a great honour. While I see the seasoned veterans like Gregory Campbell and Nigel Dodds and so on in the audience, I'll probably get into trouble for that later. But anyway, we'll just stick with it. 6 months ago, the party gave me the very small portfolio of health. It has been an extremely busy journey, and I am grateful for the ongoing support and contribution of colleagues Alan Robinson in the Assembly and Jim Shannon at Westminster. The remit is enormous, the challenges even more so. Since the restoration of devolution, one health minister who professed their love and commitment to the job promptly upped and left it. His successor, only a few months in, has landed another job. But be clear, conference, the depth and breadth of the challenges, if they are to be addressed, first and foremost, requires commitment and focus. The recall of smear tests of 17,500 women in the Southern Trust and the lack of any services for ADHD are some of the early issues. As a party spokesperson on health, I am currently preparing our response on the proposed new public health legislation from the Department of Health. This has caused much controversy because of its potential impact on personal liberties and freedoms. George Orwell said, "We know that no one ever seizes power with the intention of relinquishing it, and we recognise and share the growing concern around some of the powers and controls in what is proposed, fears around personal liberty, and the checks and balances that are needed to ensure that government does not abuse its power with unnecessary infringements on people's lives." And on this, we will stand strong, unlike the health minister, who last night said he didn't agree with his own consultation. Maybe he now should withdraw it and start again. This week, Alan and I brought a motion to the Assembly on an issue that negatively affects every family across Northern Ireland. That issue is waiting lists. Thousands of people waiting for years on hip and knee replacements with little quality of life. Just imagine the terror and fear of any woman in this room who finds a lump on their breast, to know that only 1 in 3 women in Northern Ireland will be seen with that condition within the recommended time. The Department of Health has not achieved a waiting list target since 2014. As I recently said in the Assembly debate, this is obscene. And I think the department has become so ground down by ever-growing waiting times that they have actually lost the belief that things can be better. It's not enough to keep your fingers crossed and hope that things might work out. Their response needs to go beyond, "Give us the money and we'll do a bit extra." We need a new approach, not tinkering at the edges, an approach that has a realistic chance to succeed. We need to look beyond Northern Ireland in the short term for partners who can assist us. There are national and international providers working in Great Britain and the Republic of Ireland, and we should seek to establish relationships with them. Lord Darcy's report last week, although primarily about England, has echoes of many of the problems we find in Northern Ireland. Lord Darcy found that there were 2.8 million people in England who were unable to be part of the workforce because of long-term sickness. That's up 40% on pre-pandemic levels, mostly accounted for by mental health issues. Half of the current waiting lists for inpatient treatment is thought to comprise of adults of working age. Improving access to care is crucial for wealth creation and prosperity. Too many people are ending up in hospital because not enough is invested in their community care. GPs and mental health services are two vital measures. Fixing a broken social care system should also be a priority. Patients can't flow through our hospitals properly because there is no care for them, either in their own homes as support or within the community. When I asked the Minister back in March how many patients medically fit to leave were having to remain in hospital taking up vital beds, he confirmed that figure to be more than 600 every day. Now, conference, 600 beds completely out of use across Northern Ireland every day. That is like locking the doors of the Royal Victoria Hospital or two of our medium-sized acute hospitals, and then expecting our health service to function effectively. Yet it should not require rocket science to improve this. I've also been pressing the Minister over the amount of time that our consultant surgeons are spending in theatre, and the figures there are equally shocking. In Belfast and the Northern Trust, a surgeon will only spend 30% of his time in theatre. In the Southern and Southeastern Trust, that falls to 20%. Folks, the Western Trust couldn't even provide an answer to that question. Now, how can that be? And how can there be such a difference from one trust to another? And why is it being tolerated? Whilst our staff are hardworking and almost broken by the burden of care, it is evident that our system is inefficient and in clear need of reform. Conference, while it is important to lay out a vision for a world-class health service, it is also important to confront the policy decisions that would devastate our health service and undermine the sanctity of life that we uphold as a party. In other parts of the United Kingdom, some are attempting again to legalise assisted suicide. This is simply wrong, and we as a party must speak up for the vulnerable in our society who deserve fully funded care. Assisted suicide is not compassion. It is simply a manifestation of a health service and of a society that has lost sight of the real dignity of human life. In all of this, Canada stands as a stark lesson to those who wish to implement assisted suicide in the United Kingdom. What started off there as a tightly defined piece of legislation, limited in scope, has rapidly expanded. Today in Canada, people with non-terminal conditions, mental health issues and disabilities are presented with suicide as a therapeutic option. Death sold as treatment. Conference, the DUP is a pro-life party from the first breath to the last. We need to show how good palliative care works and point towards medical pathways that lead to life and better outcomes. We need to be ready to defend the inherent dignity of human life. Mr. Chairman, the challenges in health are vast, but we as a party don't just state the difficulties. We have a plan to do things differently. Firstly, by accepting that our waiting times are well beyond acceptable, in fact, utterly appalling, and that more of the same from the health department just simply won't do. We need to increase our capacity by looking nationally and internationally for providers to help in the short term to reduce waiting lists and backlogs. We need to organise our waiting lists and the services to tackle them on a Northern Ireland-wide basis, with an entitlement to the same time and same access to care, regardless of where you live in Northern Ireland. We need to establish a small, dedicated team accountable for resolving the delayed discharge debacle and freeing up hundreds of acute beds in our hospitals. We should revise how funding flows through our system to ensure certainty and consistency, and get on with actually implementing Professor Bengoa's report through clinically driven change. We should resurrect and reinvigorate the Transformation Fund, initially supported through the DUP Confidence and Supply Agreement. And we should properly fund and staff our GP surgeries. And finally, conference, we need to allow our clinicians to get on with caring for patients, not having to battle against a debilitating system. Conference, to start making a real difference, rather than simply treading water, we need to look at solutions in a fundamentally different way. That will require the department and the wider executive to be much bolder and more imaginative than it has ever been before. The DUP is up for that task, and we hope others are too. Conference, thank you for your support.